Outbreaks happen every day around the world. The challenge is preventing any one of them from becoming the next pandemic. Speed matters to stop a spark from becoming a raging fire. We need eyes and ears everywhere to quickly identify and report unusual events in humans, animals, and the environment. This approach is called participatory surveillance. Communities are actively stepping up to become part of the solution. In Cambodia, people are reporting health events in real time through a free national hotline. In Thailand and Tanzania, local health workers are finding outbreaks in animals before any spread to humans. And in Brazil, this approach was used for the first time during mass gatherings. Everyone has a role to play in stopping a threat anywhere from becoming a threat everywhere. Expanding participatory surveillance across the globe will keep us all safe from the next yet unknown threat. Help us empower all communities to stop pandemics before they start.
A very good morning, pleasant afternoon, and restful evening to everyone joining us today. I'm Dr. Mark Smolinski, President of Ending Pandemics, a not-for-profit organization in the United States that provides catalytic funding and technical assistance to find, verify, and contain outbreaks faster across the globe. Thank you for your time and attention for the next 90 minutes, where I guarantee you will learn something, be inspired, and go away thinking differently about disease surveillance. In this opening video, we showcase several systems which Ending Pandemics has been a proud partner to create participatory surveillance, which for us is the bi-directional process of receiving and transmitting data for action by direct engagement of the target population. These partners and others have helped us expand this innovative approach to disease surveillance to all corners of the globe. At the 4th International Workshop on Participatory Surveillance, known as IWOPS, we launched this interactive map where you can look at all of the participatory surveillance systems across the globe, click on the icon, and you'll be provided with basic information about all of these systems, whether they're human, animal, or environment, along with the ability to directly contact the persons who created that system. In addition, you can filter it from the various sectors of One Health to see any combination of human, animal, or environment, or any specific one you want to look at. And in addition to the filters, you can search by the program or the country name. Seems like our video may have stopped here. All of that same information will be available. Most importantly, and this is where you can search by the program name or the country if you happen to know it, but we've created an ability for anyone to add their system to this map, and you do that by just clicking on one of the links that you'll see on the far left, as well as we have a guide for people using this map the very first time to show them all the various features. So we hope you enjoy exploring this map. It was a 2-year process to create it, but today, we're going to hear from 5 One Health pioneers who want to add a system to this map. And so each of these programs you're hearing from today were awarded a planning grant from Ending Pandemics to develop an action plan within 6 months with one of 3 aims, either to create a brand new One Health participatory surveillance system, to add a new sector to a current participatory surveillance, for example, adding wildlife to a human system, or lastly, to adapt a community-based one-way system to become the bilateral tool, now providing direct feedback to the community. So our 5 programs are across those 3 different criterias. But before we dive in, just a few housekeeping items. We will be joined by Nomedi Divi, our Executive Director at Ending Pandemics, to lead the Q&A with the virtual audience for the final 30 minutes of this webinar. So feel free to place any questions that you have in the Q&A section of Zoom at any time during this webinar, and we will attempt to get through as many of those as we can. We've asked each partner to record a 5-minute video that highlights some of their key messages that they want to share with our virtual audience today. And then following each video, I will engage our partners live in a brief dialogue before moving on to the next project. So we will only spend a total of 10 minutes on each project. So buckle in, listen up, and enjoy this whirlwind trip across the globe. As we have several panelists for this webinar, we're going to forego formal invitations to save time, and we've placed their brief bios in the chat window of Zoom, so you can look at that for additional details. So let's dive in. First, we're going to hear from Dr. Mei Nguyen at the Nanyang Technological University on their project, Collaborative Development of a One Health Participatory Surveillance System for Infectious Diseases in Chiang Mai, Thailand. Let's roll their video.
Hello, good evening or good morning from Singapore. I'm Mei Nguyen, and I have the pleasure of sharing about our team's efforts to develop a One Health participatory surveillance system in Chiang Mai. Let's begin. Chiang Mai is the second largest city in Thailand. It's home to 1.2 million people, surrounded by beautiful mountain ranges, and it's also a major travel hub. Compared to other provinces in Thailand, Chiang Mai is one of the areas that's most affected by dengue. It ranks 6th place for dengue morbidity rate in 2020, and due to its geographical location and popularity as a tourist destination, it remains vulnerable to dengue transmission and the introduction of new serotypes and genotypes from other regions around the world. In 2014, the Participatory One Health Digital Disease Detection, or PODD system, was established in Chiang Mai. It's a community-based surveillance system that's used to detect and manage zoonotic threats. Through PODD's mobile application on the Line app, the villagers and community volunteers are empowered to report potential human and animal disease outbreaks. Local government officials and health experts then work with these volunteers to implement appropriate measures. Such an approach allows for a swifter response to emerging disease threats and reduces over-reliance on centralized government support. Now, prior to this project, the research team had developed and implemented Mobus Plus, which is a citizen-centric digital surveillance system to bolster dengue prevention efforts in Colombo, Sri Lanka, which is about 4 or 5 hours away from Chiang Mai by airplane. Its features include streamlined case reporting, tailored statistics and graphs, and hotspot mapping of outbreaks. We also did predictive modeling and community engagement channels, as you can see in this slide. So the integration of Mobus Plus and PODD came about as follows. We collaborated with the PODD team and identified several Mobus Plus features that could be incorporated into the PODD app to enhance its capabilities for dengue detection and prevention. First, we added more parameters to the dengue reporting form that was already in use by community volunteers, so as to allow for more accurate information to be captured. The dengue data from volunteers and local governments was also visualized using hotspot maps and graphs of Chiang Mai. Predictive surveillance capabilities were added, building on historical dengue and weather data. Additionally, local villagers can assess educational materials to improve their community's dengue-related knowledge. So in August 2023, at 3 sites in Chiang Mai, we conducted a usability study using this new improved PODD/Mobus Plus feature. These 3 locations were chosen for their topography and community profiles. Data was collected from PODD users, including community volunteers and local government officials. So our preliminary findings based on the work that we did in the field indicates that the new features were well received, with particular interest in the predictive surveillance feature and the ability to view dengue statistics visually in a graph format. Local officials were also very keen to use the predictive surveillance in particular to help them plan and allocate resources for dengue management more appropriately. The community volunteers shared a lot of insights and sentiments with us. They found that previously they didn't have educational materials that were timely and useful, and now they had access to these. And this helped to educate the other members of the village that they interacted with. They also suggested to us some areas for improvements. For instance, they hope that the new knowledge modules would continue to be introduced under educational materials so that we have more updated features. They also suggested implementing notifications whenever new information is available, and also if there are new dengue developments in the area. In closing, we would like to extend our heartfelt gratitude to our funders, Tides Foundation and Ending Pandemics, our dedicated research team members from the different organizations and universities, and collaborators for making this project possible. Thank you very much for listening.
Now, please welcome Anita Scheldenker, a research associate at the Wee Kim Wee School of Communication and Information and Nanyang Technological University in Singapore, who works very closely with Dr. May. We have supported NTU in their development of MoBuzz, a tool to monitor vector-borne disease, as well as supported PODD, the system developed by Chiang Mai University of Veterinary Medicine. It has been a real delight to see these systems joining forces so that they can add a sector to a previously operating One Health participatory surveillance system, in this case, vector-borne diseases. And we're equally excited to see this collaboration happening across national borders. So with that, I would like to ask Anita, can you help us understand how this collaboration occurred between MoBuzz and PODD?
Okay. Hi, Mark, and hi, everybody. Thank you for inviting me to speak today. The collaboration was really because both PODD and MoBuzz have worked closely together with Ending Pandemics before. So we've crossed paths on several occasions. And I've worked with digitally mediated health applications for quite a few years now. And one of the things that keeps being highlighted to me when doing usability studies and interviews and things is that there are so many research groups out there who are trying to utilize participatory surveillance to reach the same end goal, essentially. So I think it's really valuable to be able to see what other research groups have done and work together to try and take the best bits of different applications. Sometimes you don't have to reinvent the wheel. So it's much easier and quicker to adopt something that has already been successful. And it has potential to work in your context. So in our case, PODD had already had some basic dengue features and wanted to enhance their part of the system. And MoBuzz specifically focused on dengue, and we're looking to expand and test that in other regions. So it seemed like the perfect collaboration. Yeah.
Great. And I'm curious, as you were helping PODD by bringing a feature of your tool to them, have you learned anything more about MoBuzz through that collaboration that's also made you adapt or change your tool?
Yeah, I mean, it's a bi-directional learning relationship. So they had a lot of things in their app that, for instance, their predictive surveillance, we found that they had a lot of features that we thought maybe we can add into ours. So they have things like air quality, which we haven't really looked at yet. So we were thinking, maybe we should look into looking at air quality as well to add into MoBuzz. And yeah, certain things like updating the notifications for educational materials on a more regular basis. Yeah.
Awesome. And so what were some of the specific challenges or gap that you encountered during this project and how did you overcome or address them?
Well, there were definitely some challenges. One of the big hurdles was actually the language barrier. Our team conversed predominantly in English, while the local Thai volunteers spoke Thai or Lana Thai, which is the Northern Thai language. So to bridge that gap, we organized our focus group discussions in Thai with the help of PODD, who were super helpful and assisted with everything. And similarly, when we interviewed the government officials and PODD staff, we relied more on the collaborators to help with translation and back translation for those who couldn't speak as much English.
Great. And so we know that you've, during this process, had a lot of interaction with both local government officials and various volunteers. And can you share like some of the, most significant lessons that you've learned from that, and how the insights of working with these different groups have really helped shape your project direction and your goals?
Yeah, I mean, it's very different in a way with Colombo, which is where we worked before in Sri Lanka. Colombo is very city-based, very they have a high internet penetration rate, whereas Chiang Mai is a lot larger and a lot more diverse in terms of topography and community demographics. So it was interesting to be able to adapt to the different context and find what worked and what didn't work in different places. So it's definitely something that has been highlighted to us. Yeah.
Terrific. Well, we thank you very much for staying up this late on your side of the globe to share your insights. And I'm sure we'll have questions coming in and come back to you at the end with comments or questions from our virtual audience. But thank you so much, Anita. And we really appreciate that. And so next we're going to hear about an inclusive community-based surveillance for cholera in the Bambuso subdivision from the Out Cameroon team. So let's roll that video, please.
Simply put, the community-led participatory community-based surveillance and response system seeks to empower the communities of Bekum and Bambuso, which are maritime fishing communities in the Kondo-Titi Health District in Cameroon, to lead cholera surveillance and response as a way to reduce morbidity and mortality related to cholera, which is endemic in these communities. It is creating a collaborative partnership between the communities, Ministry of Health, civil society organizations to establish a truly participatory community-based surveillance and response system. This project is funded by Ending Pandemics. In our experience, the needs of a population can only truly be determined by themselves and not based on external perceptions. As part of the development process of the action plan for the system we share here, we conducted a formative research after the initial stakeholder meeting to introduce the project and get community views on the way forward. The formative research had a retrospective part, which helped us determine the community surveillance need to be mainly on cholera, followed by measles, and a prospective part, which involved structured questionnaires administered to capture needs, attitudes, as well as willingness to participate in a PCBS system. Also, 9 focus group discussions were organized across 5 communities. The results from this formative research are the basis of the context-specific needs and proposed plan for the community-based participatory surveillance system we are working on. From the moment of inception, prior to applying for the grants, we had communicated with the community leaders, administrative and Ministry of Health leaders at the central, regional and district level of the ideas we had for their contributions and support. Once the grant was approved, an approval from the Ministry of Health was provided by the Directorate of Primary Health Care, who was physically present for all 3 workshops related to the project. The community leaders, chiefs and local health administrators led mobilization which made the formative research possible. They managed the project steering committees, and some of these leaders managed to mobilize members of the communities to march and Labor Day as a way to engage community members on the work being done and to openly demonstrate their commitment to the project. By December 2025, the project would have led to a 50% decrease in outbreak events, cholera and measles within the subdivision compared to baseline data, a reduction in the average lag time from first suspected cholera case to reporting by 75%, a decrease in the incidence of cholera in Bekum and Bamuso subdivisions by 50%, a decrease in the annual community cholera-related mortality by 40%, 50% of households having a household emergency cholera response kit, and improved community knowledge, attitude, and practice related to cholera by 50%. Based on the resource plan for the project, state CBO and committee engagements have been secured. Also, the Health Department of Reach Out is working on the final stages of a collaboration with the Faculty of Health Science, University of Boya, Cameroon, to create a Center for Excellence for Community-Based Surveillance, to be hosted by Reach Out and jointly run through an MOU by the Department of Public Health and Reach Out in partnership with the Ministry of Health through the Subdirectorate of Primary Health Care. The current estimated cost for all financial, human, and material resources required to start and run the system for 18 months stands at 208,000 Canadian dollars. Of this needed amount, in-kind contributions from the affected communities to show their commitment and from Reach Out come to a total cost of 21,655 Canadian dollars. Sustainability will cost far less as the system stabilizes and the need for physical field supervisory missions reduces. This will continually improve as the Center for Excellence for Community-Based Surveillance and its partners commit to bring in more local partners to generate sustainable local funding to continue and sustain the system. A financial seed grant to cover the cost of running for 18 months, while local collaborative initiatives roll out the local sustainability and resource mobilization plan. Technical support and oversight through collaboration with all technical assistance from an entity with experience establishing a similar system successfully. Collaborative technological partnership to improve system efficiency through an effective integration bell and wheels SMS system to permit community members to be able to report directly as well. Reach Out NGO says thank you to the Ending Pandemic teams and all the viewers.
Great, thank you. So please welcome the team from Reach Out Cameroon. Today we have Dr. Matuge, a medical doctor who has created and ran several community-based surveillance systems. Margaret Dosen, project manager, humanitarian, and philanthropist. And Pride Yanu, programs director for Reach Out Cameroon. Welcome, all of you.
Thank you.
Thank you, Mark.
So let's start off with gaining each of your perspectives on a critical element for any new idea to take hold, and that's political will. And it appears you were able to gain political will to explore this creation of a community-based participatory surveillance system, including what I heard that you had participation of the director of primary healthcare in your workshops. So how difficult was this process of gaining this political will, and how has it made an impact on your project to have that support? So maybe we'll start with Dr. Matuge, and then Margaret and Pride, feel free to add to his response. So over to you, Dr. Matuge.
Okay, thank you very much for giving me the floor. And I would say it wasn't the easiest thing to do to get that political will. It was a combination of a strong high-level advocacy and opportunity. What I call here opportunity is the fact that last year, these two communities had an outbreak which affected like 6 other health districts. And we came to a point where we're having more than 2,000 cholera cases a day. So it's on the hot list on the Ministry of Public Health, health districts they're working on. And we used that as the opportunity to get a buy-in for them and get the minister to assign the directorate to follow up on this very closely. And the advantage this has offered us in our project is that when the community members and local stakeholders saw such a high dignity come down, they were more motivated to put in their full efforts. They believed that this will not come to nothing. And they just trusted the project more. And they even made a demand, which they have been trying to make for about 10 years unsuccessfully, to have their area delegated as a health district on its own. And for the first time, these communities will be receiving a medical doctor assigned to them, thanks to this project and engagement that we had. Thank you.
Wow, that's fantastic. Margaret or Pride, did you want to add anything about the political will and engagement?
Okay, thank you very much for giving me the floor. To add to what Dr. Bituke has said, I'll say for us to have gotten a political will, we needed to consider the three levels we have here. Like we had the ministry, the district, and the community level. As said earlier, at the ministry level, we had to communicate with the Subdirectorate of Primary Healthcare, who saw this project as an opportunity to fight the recurrence of cholera in the Bamuso subdivision. At the district level, it was very easy because Reach Out, before this project, has been working with the district to be able to fight cholera during their outbreaks. We have been going down to the field to support them with materials and provide emergency kits. At the level of the community, we had a little challenge because at the community, we understand that we have different community members. We have the local administrators, the traditional rulers, and the communities themselves. Which had at the beginning a little tussle of power, but we are happy and we can gladly see at the end they also this as an opportunity to improve the quality of life and health of the Bamuso population. Thank you very much.
Thank you. Pride, if you have something to add, otherwise maybe I'll direct the next question to you.
Yeah, I'll add to that. I think it speaks to who we are as an organization. Reach Out is 26 years operational in Cameroon. And I'll add to that we are the humanitarian sub-recipient of the Global Fund. And because of that, we've been working directly under the Ministry of Public Health. And that gives credibility to the work we do. That gives some level of acceptance and seriousness whenever we call. Political will is always an issue. But when we've proven for over 26 years now that we've been operating in the health sector in Cameroon and one of the biggest civil society organizations contributing to the malaria program in Cameroon and general healthcare system in Cameroon. So the ministry takes us seriously, and I think that helped in us getting that political will for this particular project as well.
Great, thank you so much. So in your video, it was very ambitious goals that you set to have a 50% decrease in cholera and measles and 50% of households having a cholera emergency kit once your plan is operational. Can you each or one of you speak to what you see as sort of the biggest hurdles to actually be able to reach those ambitious goals in an 18-month period of time? I'll open it up to whoever wants to take that one.
Mark, I'll step in first on that. So yes, we've already let's say foreseen that Bamuso is a maritime community, and telecommunication networks are a big issue around here. And in our plan, in our project reports, we did state that we are currently in close talks with two local telecommunication networks to see what's possible, how they could be of help when we roll out, such that the communication between the people in these areas, which is hard to reach, both through transportation and communication, becomes better. And with regards to the ambitious targets, we actually did try to make sure we are moderate, because these targets were not generated by us from space. It's based on research that we conducted and also on experience. Currently, it takes about 2 weeks or more for the first reported cholera case to be reported to the state officials or to the health system in place. But with this system in place, we will be able to reduce that to 1 day. We've done that before in another health district when you had to do again with cholera, but it was not a fully established system. We think it can be done here. Once we reduce the lag time between the first case and when it's reported to the health system to 1 day, literally we can prevent outbreaks or contain them easily. Yeah. With regards to the community cholera kits, literally from the research, the formative research we had, the communities actually 95% of people are willing to remove their own money and purchase kits, not receive them for free. So we even downplay saying, if we do have a lag time, let's say we delay in coming for the project and community members change their mind, at least 50% will still be able to meet up. Thank you.
Great, thank you. Well, I know we're past our time on this one, and I'm sure people have lots of other questions. So We'll come back to you in the group chat for Pride and Margaret to also add some further comments. But with that, I thank the team from Reach Out Cameroon. And now we'll move on to hearing next about the establishment of a One Health participatory surveillance system in select hard-to-reach communities in Southeast and North Central Nigeria. So please roll the video from Global Vision for Development Initiative in Nigeria.
Greetings to everyone. My name is Alex Shenge, a trustee of Global Vision for Development Initiatives, GVDI, Nigeria. Here with me is Juliet Shenge, another trustee of GVDI.
Greetings to you all.
The title of our presentation is Inside the Fascinating World of Atoki the Cattle Rearer. This is a story about establishment of participatory surveillance in hard-to-reach communities in Nigeria. In the hinterland of Bausu, north central Nigeria, lives Atoki the cattle rearer among his community people. Slim, agile, and friendly, he is as dutiful as he is resilient. Atoki's love for his cattle is unmatched. Married with 4 kids and eagerly expecting their 5th child, this master of the bush tracts confidently has his eyes on both the present and the future. In just 5 years of planning his trade with a tsunami community impact, our team learned of Atoki's firm and resolved to touch base with him. This much we did through a dependable source who knows exactly when, where, and how to track down Atoki despite the latter's ever-busy and unpredictable cattle rearing schedule. Here comes our man of the moment as our source briefly chats him up in their local dialect about the business of cattle rearing in their rural community.
Okay.
I do hope you enjoyed a brief chat with Atoki. And so the conversation goes on. Excited about our interest in his cherished cattle rearing occupation, Atoki was quick to link up our dependable source with Jaka, a colleague of Atoki's, who similarly plied the cattle rearing trade in the neighboring Awenebo village. Here is a pictorial representation of Jaka in a brief chat with our source. From Jaka, we also learned some valuable lessons about human-animal interactions in Africa's rural setting. This equally gave us insight into more areas to target our interactions with the community members. Both Atoki and Jaka became agents of change and accepted to not only participate fully in the surveillance, but also to mobilize other headers in the various communities to be part of the surveillance group. Here are translated highlights of Jaka's views. In over 3 years of rearing cattle, Jaka says he is not aware that cattle can transmit diseases to human beings. Proper dressing while rearing cattle prevents cattle rearers from contracting cattle-related diseases, if any. Certain injections can prevent cattle from having diseases. Some people live in the same dwelling with cattle and other animals. And I'll hand you over to Juliet.
And so earlier, before encountering Atoki and his friend Jaka, our team paid initial visits to the locations in the select communities to seek the political will and support for the establishment of participatory surveillance from the community leaders. We had worked in these communities during our previous health outreaches and awareness programs. Therefore, we were familiar with the environment and knew that it was very imperative to gain the political will of local councils, community leaders, and their cabinets to be able to carry out any project. The pictures here show the initial visit we had and in some of the villages we visited. Meetings with the community leaders were successful. They accepted. The traditional councils were briefed by the traditional leaders, and the former accepted the proposed project in the communities. Now the interactions. We held meetings with the various groups of community members to explain participatory surveillance and the need for it. More interactions into the villages, even interaction we had with the women group to explain participatory surveillance. Each community now has a team, including the leaders, health workers, and volunteers, to be engaged in the reporting of health threats emanating from humans, animals, and the environment during implementation. We have the records of the reporting team. Comprehensive training of the health workers will precede the implementation phase of this project. Full mobilization of all the stakeholders to participate in bi-directional approach of surveillance has been accomplished. It has been a wonderful journey, though not without hitches. Together, through participatory surveillance, we shall prevent disease outbreaks, spillover, and pandemics to achieve one health, one world. We sincerely acknowledge the support for this project provided by Ending Pandemics, a project of the Tides Center.
Thank you very much. Please welcome the voices from this video, Dr. Juliet Chenge, virologist and of the Faculty of Science at Dominican University, and Dr. Alex Chenge, a professor of psychology who joins Juliet as trustees of the Global Vision for Development Initiative, a nonprofit that aims to be a key player for improving quality of life and optimal development of human capacity. So welcome both of you, and thank you for providing a glimpse into the views of a few cattle persons who will be using your proposed participatory surveillance system. So with that, I'll start with a question to both of you. How do Atoki and Jaka's views represent the other cattle persons in this area? For example, we noticed Jaka did not know that cattle can spread diseases to humans, but he did know that a shot could prevent diseases. So how does your system educate or inform cattle persons of these proper methodologies and control measures? And please, either one of you. Juliet, I see you're off mute. Maybe we'll start with you.
Thank you, Mark, and thank you for giving me the opportunity. And so the headers have an association where they meet once in a while in their places of work. So what happens is that Jaka and Atoki actually promised that they were going to relay what they got from us to the headers. And from there, and through networking, they were going to keep spreading the message on participatory surveillance. And of course, we know we're going to come back.
You cut out a little bit, but we were able to get the gist of that, so thank you. But while I have you, well, let's see if Alex would like to add something.
And just as Juliet was saying, Atoki and Jaka belong to the Cattle Rearing Association and cultural associations also. So there are lots of interactions, and they network with other cattle rearers. And so whatever message we pass to them, they've agreed to pass on to others, and indeed they've been doing that very well. And so it's like a snowballing kind of activity. One header connects with another and transmit the information that he has, what he has learned. It goes on like that. And then there is also a kind of a cluster among the headers, and one cluster will also interface with the other. And so it keeps going on, and the promise will continue to go on so that the participatory surveillance system will work better for the community, and the community will be better for it. Thank you so much.
Great, thank you. So, Juliet, I noticed that in the video, you made an incredible quote that you said this has been a wonderful journey, but not without hitches. So we learn as much from our failures as our successes. So I'm wondering if you're willing to share what were some of the hitches that arose during this process?
Thank you, Mark. And so we had some hitches. Number one is the inclement weather condition that actually was trying to pose a problem, especially the rains. The rains were much. At the time, getting access to the villages became a very big problem. But we were able to navigate this. Our team, who were close to these places, were provided with the necessary, some of these like raincoats, umbrellas, and they were able to navigate the villages. Number two is the bad terrain. The roads are very rough. So in this situation, what we had was we had to lease very rough cars that were able to access the roads at that time. Then infrastructural deficits. We have issues with internet facilities. So what we did in that situation was to subscribe to multiple telecommunication providers. There are different ones, MTN and all that. At different times they operate that we'll be able to get signals. So that was what we did in that situation. And again, health issues that arose, the two members of the team that fell sick at different times, but they were actually taken care of at that emergency level. So those are some of the challenges we encountered. Thank you.
Great, thank you. And I'm sorry that we're getting a little behind on time. So I thank both you and Alex for sharing this particular part, and we will be coming up with the Q&A for the group. So we have a few other additional questions that we can pose at that time. So thank you, but let's move on to our next video and hear about a planning for participatory multi-sector wildlife health surveillance in Peru from the Wildlife Conservation Society.
Good morning, everyone. My name is Paulo Belchao. Today, I will present how we develop a preliminary action plan to establish an effective and sustainable national multisectoral wildlife health surveillance system in Peru under the One Health approach. The health of humans, animals, and ecosystems are naturally connected. However, the past year H5N1 highly pathogenic avian influenza outbreak in Peru put on evidence the little understanding of this bond and highlighted the lack of preparedness of the government and civil society to address a health emergency that involved wildlife, domestic animals, and humans. Although the different agencies had partial solutions, there were not a multi-sector roadmap to follow, hindering an effective coordination and involvement of different stakeholders, impeding a quick response to the outbreak from the beginning. Therefore, our purpose is to develop an action plan for a single national participatory multi-sector wildlife health surveillance system. The idea is to leverage in the existing agency systems and incorporate community participation to detect and to respond to wildlife health threats early, and be prepared with clear protocols to deliver an adequate, timely, and coordinated response to an emergency. To start developing this action plan, we needed to better understand the different wildlife health stakeholders. We need a participatory and consultative analysis of their main interests, concerns, functions, and capacities regarding wildlife health. First, we had meetings with focal points from agencies from different sectors, like human health, wildlife and protected areas, and animal health sector. We complemented this information with a legal analysis of official roles and functions of governmental agencies. We improve and validate the analysis in different spaces and symposiums organized by government, academia, and international cooperation institutions. Our analysis shows that currently there is not an adequate legal framework or resources for wildlife health management. Also, it has been evident that the Peruvian authorities and institutions only partially address complex problems surrounding wildlife health through isolated efforts. However, there has been an increasing interest to close these gaps. To move to the action plan, we organized 4 workshops to present the analysis results and co-organized a seminar with CDC Peru on multisectoral rabies surveillance, all to outline the action plan with multiple sectors. A common ground during these meetings has been the need to advance a comprehensive and effective treatment of wildlife health with a One Health approach. First, there is an urgent need for government authorities to clarify each stakeholder's specific roles and functions and develop an express mandate to undertake wildlife health surveillance cohesively between relevant government agencies. It is also essential to support, finance, and promote research on the complex and interconnected topics around wildlife health to reduce information gaps. Finally, it's needed to establish sustainable collaboration mechanisms between competent and strategic governmental and civil society entities, both administrative and scientific ones. WCS recognized that working with various stakeholders is an ambitious but necessary challenging task. However, these tasks have helped catalyze the political will and trust, fundamental to building a surveillance system for wildlife health. The diagnosis of the roles and functions has also sparked conversations around possible mechanisms to change their institutions, regulation of organization and functioning, known as ROFs. Furthermore, bridging capacities and leveraging in existing initiatives are essential to contribute to the development of systems instead of creating new ones. Finally, despite biases and different views among stakeholders, at the end of the project there is a widespread interest and awareness of the need to implement a One Health approach in Peru. Their commitment to implement this approach strengthens the project's sustainability. We thank Ending Pandemics for their support and all the stakeholders that participate from the process of this project.
So please welcome Paulo Colchao, a veterinarian and wildlife health specialist from the Wildlife Conservation Society in Peru. Welcome. So Paulo, in the video you mentioned that the community was gathered to discuss rabies as an example of a zoonosis. And I'm wondering if you can share with the audience, how does the discussion on a specific disease help guide a process of developing a new system? But even more so, are you confident that in the end, your system will be able to detect any new or re-emerging infection in wildlife?
Of course. Good morning, everyone, and thank you for this symposium. So the idea to work on one specific disease like rabies, this disease is probably the only one disease that have a surveillance system in Peru that involve human health, animal health, and wild animal health. So the idea is to leverage on these already built systems to work toward a more broad system and to have a specific examples of this and how it could work, you know? Because now also with rabies, there's these new outbreaks in other wildlife species that are not vampires. So the government is getting interested on this. So you also were talking about political will. And to build that is also important to make the connections with these diseases and how wildlife connected to the One Health approach. And of course, I'm confident this will work. Sometimes it can be kind of overwhelming to see. Peru is a huge country, it's big. So you have a lot of ecoregions, it have a lot of biodiversity. So there's a lot of species that can transmit any disease. So we have to leverage on this existing system to start building it up and to make the government and the public to know more about these diseases. So yes, I'm confident this will work.
Great, thank you for that. And I know you had the recent highly pathogenic avian influenza or bird flu that you mentioned in the video. And I'm just wondering how that recent experience changed any behaviors or attitudes in Peru regarding zoonosis, and maybe did it increase the political will for a system such as yours?
So yes, so the avian influenza outbreak, what it made to happen is it put a really good put interest on wildlife diseases, because there was nothing about surveillance on wildlife health. So when it started, there were no data about how many animals were dead in the past, if this was normal or not, how to record this information, how to transmit this information to the authorities that have to do control or have to do something with the outbreak. So they start to building organically this system with the avian influenza disease approach.
A final question for you. Is there any particular challenge or success story through this process that you want to share with the audience?
So yes, I think the political will have increased. Now the government is trying to work towards a One Health law in Peru to include all these sectors into the health in Peru now. So yeah, that's
terrific. Well, great. Well, thank you very much for that. And again, we'll be asking the audience for questions after this last video. So let's move on to our final video where we'll hear about participatory wildlife health surveillance with an integrated One Health response mechanism in community managed rangelands by the team at the Smithsonian Global Health Program.
To address this gap, we have designed EarthRanger Health, which extends the EarthRanger platform to connect people living and working in remote, biodiverse landscapes and their observations of animal health to decision makers in conservation, veterinary medicine, and public health. The power of harnessing EarthRanger is that it is already being used for protected area management in over 40 countries. We are currently piloting this participatory syndromic system with community rangers in conservation areas of central and southern Kenya in partnership with the Kenyan government. Early results suggest the system is capable of detecting morbidity and mortality in wildlife, and rangers are gaining new knowledge from their training. In our planning grant, we set out to explore the value proposition of this system to pastoral communities who live on the front line of wildlife-borne zoonoses, and to government stakeholders who are responsible for controlling these diseases. We also sought to explore response capacity, particularly how broader participation in the design of disease management plans could promote more effective and sustainable approaches to controlling wildlife disease.
Community data was collected through focus group discussions conducted with community participants from conservation areas where the EarthRanger Health tool is being piloted. The community's desire for better management of wildlife-borne zoonoses was evident, with benefits including improved health of all animals, people, and the environment. Opinions on economic benefits were particularly diverse, ranging from direct impacts on their livelihoods through animal health, trade, and reduced burdens on healthcare systems, to more nuanced connections between wildlife health, biodiversity loss, and local economies. The community members showed that they would be good reporters of wildlife-borne zoonosis syndromes. They also demonstrated the ability to identify baseline signs of illness in wildlife, having gained these skills through experience and indigenous knowledge over years of close interactions with wildlife.
EarthRanger Health brings in a huge value in wildlife-borne disease control. And if you look at the different stakeholders, people like the communities, talking about public health, the government, the earlier you detect the disease, the better. So that to me is a huge value. You're able to detect that disease before it spreads out, before they spill over.
The intricacies of biodiverse working landscapes present both challenges and opportunities for managing wildlife-borne diseases. Traditional medical and veterinary interventions tend to be reactive and can be less effective for pathogens with complex transmission pathways. Including ecological and social processes that precede outbreaks and broadening participation in management planning could identify leverage points that unlock a wider range of potential interventions. We put this into practice by bringing together diverse stakeholders in Kenya to develop a participatory framework for identifying and prioritizing interventions. The group focused on 4 wildlife-borne zoonoses with an environmental stage in their transmission cycle. From this process, we developed a framework that positions leverage points and interventions within the context of relatable, real-world landscapes and complex transmission processes. Strikingly, we found that using this framework, workshop participants identified 73% of all evidence-based interventions in the published literature for our 4 pathogens.
By encouraging co-production of knowledge, ideas, and consensus on how to manage complex disease systems, this approach shows huge potential. It could be applied to enhance action plans for disease prevention and control in a way that is both ecologically and socially informed and beneficiary oriented.
To reach this point, though, we need to grow our team, specifically with support for young African data scientists and epidemiologists. Being based on technology that is already being widely implemented and a framework that can be easily adapted, our approach is both cost-effective and scalable.
Well, thank you very much. And please welcome the voices in this video. We have Shailene Ngweni, the Wildlife Health and Disease Manager from the Smithsonian Global Health Program and a researcher from Kenya. Dr. Stephen Chege, epidemiologist and wildlife veterinarian from the San Diego Zoo Wildlife Alliance and Vet and Wild. And James Hassel, the Squirton Scholar from the Smithsonian Global Health Program, who's also an epidemiologist and wildlife veterinarian. So welcome all of you. I hope our audience was able to absorb all the incredible messages while captivated by this outstanding video. It's clear that ending pandemics and the Smithsonian share the key values of co-creation, the all of community engagement, adapting currently available technology, and reaching out towards that first mile where the emergence of diseases occur by engaging the most proximal persons in contact with wildlife or the ability to monitor them. So thank you for sharing that. Let me start with Shailene. You spoke in the video to ecologically and socially informed control measures by co-production with the community. What role do pastoral communities currently play in the wildlife-borne zoonotic disease management in Kenya? And how will your platform change this?
Thank you very much for the opportunity and for the question as well, Mark. So currently we have over 65% of Kenya's wildlife outside protected areas, which is where the pastoral communities are traversing the landscape in search for pastures and water for their livestock, which they hold near. To them. And so when they do come across any sick wildlife that they see across the different landscapes that they're in, they do report these cases either to local conservation organizations that are within the areas that they're in, or to the Kenya Wildlife Service, who also have the mandate to take care of the wildlife. However, how they report has their limitations and challenges. So sometimes they have to physically go to the offices, which, knowing the landscape and the rangelands we have, is of course something difficult and that can't be achieved quite easily by the communities as well when they are again looking for different pastures and water. So what we're hoping the Earth Ranger Health platform is going to be doing now, first of all, when it comes to designing it, as we've mentioned, we're ensuring that we have the stakeholders from the communities all the way up to the government level having their input into what this app should look like. So by the grant that we received from Ending Pandemics, we were able to have these focus group discussions with communities and different community rangers as well as to, what disease syndromes have they seen, what species are being affected in the different areas. And that is all information that is going into designing this specific tool to ensure that they have a say in what's happening and the different steps. And it's not just, of course, the directions coming from government and above. And then also basically asking them, who do they believe from the communities are best placed to be the people we train to be able to take up this tool and carry out the disease reporting and being part of the disease responses as well once the different stakeholders intervene. So yes, we're hoping that the tool, as we continue building up on it and training more people, is going to be a tool that's enabling the communities to have a more active role, and they're also being formally recognized in the role that they are taking in disease reporting, and as well as being involved in the response side of things. So when there is a zoonotic disease outbreak, they are aware of what the risks are, and they're able to share that information across the different community members. And in that way, we're enhancing the health of the wildlife, the livestock, and the people as well.
Right, thank you. So for Chege, can you help us understand from the Kenyan perspective, what do you see as the greatest challenges in managing zoonosis or emerging infections? And maybe even what is the single most important gap that your platform can kind of address to fill?
Good morning, good evening, and thank you very much, Mark. And I think I'll start with the first one, which the last question that you have just asked about the gap that we think our platform is actually going to fill in. And as my colleague, Dr. Charlene, has already expressed, in Kenya, we have had a system whereby, so the professionals or the people that in the management, actually, they're the ones who have been doing almost everything. And there's been a huge gap with actually the people at the down level there. And we are talking about people like the communities who actually bear the greatest brunt of these diseases. And they have the information, but reporting that information has been a challenge. And what we are hoping to do is actually to fill in that gap by making sure that at least the communities, the people, other different stakeholders, which include the communities, they come in and they're able actually to give us that information. And when I say us, I'm talking about everybody else, including the government. So that will allow actually quick and faster response. The other question you have asked is, if you can remind me, please. I've just forgotten it, but
yeah, just about like the overall challenges in managing zoonosis from a Kenyan perspective.
Good. Thank you very much. So Kenya is a great and a big, huge country. Over 70% of wildlife actually is outside the protected areas. And that tells us actually there is a huge challenge. Where we find those animals, the terrain is difficult, the infrastructure is not that great when you look at even medical facilities. So professionals don't really get out there. So there's a huge gap in terms of the information out there. Do we even really know how many or how much of those zoonotic diseases that we have? We don't know. And that presents a big challenge, because if you don't know anything, then you cannot actually manage it. So what we are hoping to do is to make sure that at least we get as much information from the people on the ground who can help the authorities actually manage that. There are more other challenges, things like funding. Everybody talks about funding. Funding is always a big challenge. And I saw somebody mentioning about in the group here, commenting about things like internet. It might look very simple, but that actually affects things like communication. So how do you communicate to the people or up to the higher level or the headquarters, whereby that will help in actually decision-making and faster response to this. So there are many challenges, but I think the communities are knowledgeable and we can turn that into a positive and actually take advantage of that.
Excellent. Okay, so the final question for James, and since you have scholar, in your title, and no webinar today would be, complete without the mention of artificial intelligence. So as well as connecting community observations to wildlife health and veterinarians, your platform is going to generate a lot of spatially explicit syndromic wildlife health data. And so I'm just wondering, do you think that AI could play a role in making this data informative to your various stakeholders?
Thanks for the question, Mark. I need the new job title, I think. Hi, everyone. So yeah, I think broadly AI models or AI can play a huge role in helping to identify signals in real-time surveillance data, and that extends to participatory data as well, particularly when it's collected digitally and in a harmonized way. And that can in itself then alert stakeholders to potential outbreaks. So I'm aware of some of the work that's ongoing in the human realm to develop these kind of applications of AI for interpreting surveillance data, but there's less in the animal sector, even though there's, if anything, a greater need in the animal sector, since zoonotic disease outbreaks can appear first in animals before threatening people. So this is certainly functionality that we are looking to develop within Earth Ranger Health over the coming year. In terms of what it might look like, at its most basic, that perhaps some kind of pattern recognition that can detect and flag spatial clusters of community reported data on dead wildlife or livestock abortions, and then being able to feed that information to stakeholders. And then one of the unique features of Earth Ranger, which we are hoping to harness, is it's also being used to collect a huge amount of environmental data alongside that, that epidemiological data from communities on wildlife and potentially livestock. So I think there's potential to explore how kind of linking patterns that are linked spatially in terms of the environment and that environmental data within Earth Ranger and epidemiological data too, could have real impact on how quickly stakeholders are able to identify outbreaks of disease.
Great, thank you for that. Well, we didn't do too bad. We're only 9 minutes over from having 5 different groups present. And so thank you for the speed and the contributions that you made during this portion of the webinar. And now I'm going to turn it over to Nomita Divi, who is our executive director, and she is going to moderate the Q&A portion of this webinar. Over to Nomita.
Great. Well, thanks, Mark. And yes, I also will do my best to summarize the good questions we actually have in the Q&A section of this chat. So I'll be very casual and call our panelists by first name in the interest of time. So first, I will call on Anita from NTU. I'll try to cluster the questions to be efficient with our time as well. So one of the participants of this webinar has asked about confidentiality with regards to participatory surveillance more broadly. So can you speak to your experience with confidentiality regarding the systems you've worked on and how you might have dealt with those concerns?
Okay, so I think with everything, it's mainly people who actually want to. I mean, a lot of the community actually want to take part and want to help with actually reducing disease in their community. So, yeah, confidentiality is just you get them to ensure that they, sign off on submitting and using the app in our case. And in terms of PODD, we had local volunteers who were working with the local government. So they volunteered to do it, and they would volunteer to sign up and use the app. And even when they couldn't use the app, for instance, when there's no internet, they would go and use pen and paper and then transfer it to the app when they had internet. So a lot of the people were very, very eager to take part. And there's always, as long as you highlight, I think one of the major things that you need to do is just highlight how important it is, and have, if you have other stakeholders involved, such as an MOH or, any of the major stakeholders or any reputable names surrounding your project, then a lot of people are very, very keen to take part. So, yeah, it really depends on the region and where you are in the context, but yeah, people are quite eager to sign up to do these things. Yeah,
absolutely.
So we haven't had too many issues. Yeah.
So in terms of you touched on this very briefly in terms of the internet connectivity, and the previous speaker also talked about that as well. And you talked about even using paper in cases where that's not the case. Can you elaborate a little bit more about some of the strategies to deal with this uneven availability of the internet?
I mean, these days technology is everywhere, except for certain regions. So in Sri Lanka, we found that there was a high penetration rate, and we were dealing with Colombo, which is a city and is very highly connected. But in Chiang Mai, and this is just specific to Chiang Mai, so I can't speak for the rest of Thailand, but we specifically chose different areas that had different topography and different features on it. And particularly in Ping Kong, which is slightly north, they had a lot of forested areas and a lot of places where people couldn't access the internet. But the local participants just worked with the local government, and they were specifically chosen because they have phones, and then they can actually go into remote areas, take information with their pen and paper, and then go to wherever there's a hotspot, wherever there's Wi-Fi, and maybe that's a community center or the local government building, and they can actually submit the documentation there to directly connect with the local government, who can then access the data and then help the local volunteers and the local officials deal with the problem, the dengue problem there.
Perfect, excellent. Thank you for that clarity, Anita. I'll turn the next question to the Reach Out Cameroon team. So Alain, let's get you on the panel right here. Excellent. Okay, so the question that I have for you is, in your video, you talk about an estimated cost of over just about $200,000 to implement your action plan. This seems like a great opportunity for donors, perhaps one new to the field in disease surveillance. It's really a low bar for risk, as you have done much of the hard lifting to for them to enter this space, and you've done a lot of the lifting in figuring out what's needed to really get this action plan into action. So what would you say to any donor that is on this call to inspire them to take action and join you in this effort to expand participatory surveillance?
Okay, I will start on that, Misa, and thank you very much for that question. So literally, besides all that we have shown and all the work that we've done already, we would say in this case, we already have the government buy-in, we have our own motivation, but in our many years of working, never have we seen a community this excited to solve their own problem. They've literally proposed contributions they'll do from their end to make this work. All we need is give them a chance with our help to solve their problems. And that's what I'm saying. Let's together give the communities of Bamuso and Beku a chance. That's it for me. I think Mr. Yano may have something to regards to that.
Okay, let's see if we can get Mr. Yano on. Perhaps he's having difficulty with his connectivity. Well, while we are waiting for him to get on, or if he can't, I'll ask you a follow-on question. Something relevant to all of the programs here. What are some of the approaches to ensure sustainability of these systems and minimize the reliance on external financial support?
Thank you very much again. I think we've thought about this a great deal in our setting, and that's why in our video we said this is a seed grant to get us rolling. We wouldn't want a situation where, say, we're having a feedback meeting again in 2026, and we are saying, oh, we need another 100,000 to do something or do that. So we are currently rolling a community approach in Cameroon, again, with the Ministry of Public Health. Now there's a community plan to decentralize health and have communities take more charge. And local government and councils are showing more interest into these activities. We are already engaging them with regards to fight against malaria, TB, and HIV. We think we can follow in the same line of advocacy and get them, again, with our own help and that with the academia, in this case, our partner, University of Boya, to ensure that we reduce this cost, because many of the people we use in the system are already being used in other health programs. And that alone can eliminate a lot of, let's say, the basic cost related to human resource. We think that we don't think this is a plan where you need a year-to-year running budget. We think this should end within at most 2 years. Yeah.
Excellent. And I really appreciate what you said. Really what this is enabling the community to solve their own problems. And I think that is really the crux of participatory surveillance. So thank you, Alain, for that clarity. And I'll turn next the questions to the Global Vision Group, Global Vision for Development Initiative, with Juliet and Alex. So let's get the screen here. Hello, Juliet. All right. If we, yep, here we are. Great, Alex. Okay, so Juliet, first question to you. In the video, you talk about engaging women's groups, and I want to take a moment to just recognize, this specific group of stakeholders. Can you expand on the clout or the influence of this group in the community and why you, chose to engage them? and the relevance of the success to participatory surveillance when you engage such groups.
Thank you, Nomida. You know, the women are powerful. In every community where you see women, we talk about progress. Progress starts with women. Quality of life starts with women. And so if you could have women agree on something, just be rest assured that they will go a long way to get that, sustained in a long run. So we decided to engage them initially because we know they are the ones that are in touch with the family. They are in touch even with the domestic animals. They are in touch with so many things. They are the ones that will take to heart whatever they've learned, to put it to practice. And so when we engage them, we talk to them about participatory surveillance, telling them they are the community, they are the target, and we want them to come on board to take this as part of their own challenge to improve the quality of life and also try to prevent epidemics and pandemics, from that angle. And so that was why we had to engage them at the initial stage, knowing fully well that they will go a long way to make impact in the rest of the communities.
Excellent, and thank you for that. I completely agree with your assessment of their impact and influence. Alex, for you, a question that came through on the chat also is recognizing the diversity in Nigeria, the large landmass, 250 languages is what the audience member noted, as well as, just variation in the land in and of itself. So how do you anticipate your system ensuring that it can reach this diverse audience? And attached to that is, what type of tools do you think would be most useful to be able to ensure success?
Okay, thank you so much, Namita. Indeed, Nigeria is a very vast country with a huge population. Actually, we're at 250 ethnic groups, and the terrain is also rough in certain time. But one thing I can say is, I would say little by little we get there, because we're going to start at this level and then take it down gradually, and if the resources permit, rapidly at certain times, so that it goes down from one point to the other, and it snowballs into the larger society. And it's come by way of interaction, by way of education, by way of deliberately putting the machinery in place to make the information to flow and then to make impact, so that the participatory surveillance becomes like a way of life among the people. And when that is done, it becomes much more cost effective to work it out, and it becomes so natural that the impact is so phenomenal. And I think it's going to work that way. Thank you so much.
Thank you. Yeah, I absolutely hear from you that it is a step-by-step approach, especially where you have so much variability and the fact that it will take time and patience. And I love that it will ultimately become a way of life. Okay, well, I'm going to transition now to Paulo from the Wildlife Conservation Society. A question for you that's come from the audience. It's asking for further clarification on your methodology. Was input from the community gathered as you were doing your assessment? And how will the public be involved or participate in this participatory surveillance system that you're envisioning? And somewhat related, did Peru include veterinary services, and how was it collected with health? I'm thinking they mean the health sector as well. So I'll turn that over to you to clarify.
Okay, thank you for the question. The idea from the approach that we have is to start with the government to see how they are working and how they are building their systems and how we can leverage on that. So the idea is using the different systems that are in the field. And for example, if we are not working directly with community so far, we are working with park ranger, for example, and what we are doing is they have these patrols with the smart tool to record information on wildlife during these patrols, but now we're improving this or including wildlife health events during these patrols. So when they see a dead animal or a group of dead animals, they can report this information from this application, from their own cell phone. So that's how we are working. And the idea is to use the systems that already are, like the health sector, have a huge network across the country, and they report human health diseases, but they can also report diseases on animals or diseases on wildlife. So we're trying to build on that, and communities can translate this information to them, and them can translate to the center, not to the central network. Yeah.
Great. And then yeah, go ahead with the other sectors.
No, sorry. And the second question, I think.
Yeah, that was really if you were engaging veterinary services and human health services as well.
Yeah, we did, and we tried to work with the multi-sectoral working groups on avian influenza. So the animal health sector is included there.
Yeah.
The approach we had with them, and they are working also after the avian influenza outbreak. They are working towards to include wildlife in some of their surveillance systems.
Great. Well, thanks, Paulo. And I will ask the last group a question now. This is with the Smithsonian Global Health Group. So James, Shailene, and Stephen, if you could bring you on board. And let me ask you the first question. With regards to bidirectionality, a very important part of participatory surveillance, can you elaborate on how do you think the information given to the pastoralists will be different from the information that's currently given to rangers, and how do you anticipate that? And I'll throw in another question. You can tag team or decide how you want to take these questions. Is where do you see your platform in 1 year? So whoever wants to take the mic first, please go ahead.
I can have a go at the first question.
Okay.
So if I understand it correctly, it's how what format of the data will be received by communities as opposed to decision stakeholders
in
the system.
Mm-hmm.
Yeah, I mean, so we consider rangers as part of the community. So they're at the moment, at least in the testing phase of the tool, they are our main stakeholders within the community. So the rangers and the conservancies they work for receive data from the projects. We produce summary reports that gets fed back, and that will provide basic information from the landscape that they're familiar with in terms of where wildlife are being affected, what species of wildlife are being affected, what kind of syndromes are being detected.
Mm-hmm.
And so the idea is that will provide information back to them to encourage their continued participation. We also work, Shailene actually runs trainings once every few months. So we're repeatedly visiting the rangers and engaging with them through repeated trainings and answering questions and following up for any concerns they have around how data is being collected and how data is coming back to them. So it's an iterative process based on that kind of feedback. We, I guess just the final point to add is that because we're working with the Kenyan government here, and they have their own systems that look at livestock health, which they also are looking to extend to communities. We're trying quite carefully not to make sure we're duplicating effort on that side and that there's overlap. So we would like to, in the future, extend this platform to other members of the community who have livestock. But we need to do that in partnership with the government and their systems as well.
Yeah, I'm really glad you brought that up, because that is a question that's come in as well for other audience members who are working in Kenya as well. And they've had more success engaging with the livestock sector and are interested in engaging with the wildlife. So kind of the opposite of what you've done here. And so, they're really just looking for advice and, how to better bring the wildlife and environmental sector into the fold. And so maybe Shailene, since you haven't spoken yet, I'll ask you that question. You know, how can groups better engage these other sectors?
Let me answer the first question you asked, and then I'll switch it over to that one before I forget. So kind of where we're hoping that platform goes in about an year or so from now and carrying forward. I think within the next 1 year, we'll probably still be within the pilot, but hopefully wrapping things up. But what we're really hoping for is that it'll be a platform that will be adopted wholeheartedly by the Kenya government in terms of, again, an early warning system for biodiversity loss and also public health, especially, again, when it comes to the zoonotic disease management. And that the platform is also going to enable like more prompt decision making in terms of, again, making sure we're intervening as early as we can whenever anything comes up. And then probably also on top of that is scaling. So of course, now during the pilot, we have like a selected number of places that we'd like to get back information from. And hopefully now from there, we'd be able to scale this up across the country, across the continent, and hopefully across the world. So yeah, definitely have big hopes and we're quite ambitious, but we're hopeful that we'll be able to get there. In terms of sort of having that integration between the different sectors, which is also very important, as you've mentioned. I think it's a bit encouraging to see like Kenya has like zoonotic disease units, which is encouraging different health sectors to come together and work together. And unfortunately, fortunately, that's a bit like higher up government level, and it's not really trickling down towards the community level and making sure everyone's like working together. So I'd say one, it starts with conversation and everyone being bold enough and willing enough to just reach out to each other and the different sectors. Again, being willing to share the information across the different sides, because we're all technically working towards the same goal. We can't all like just be running like parallel paths. So yeah, I'd say it's definitely just reaching out to each other and learning from each other. And that goes beyond the health sector towards, you know, more environmentalists, ecologists, and that side of things. So yeah.
Great. And Stephen, in the last 30 seconds that I have for you, anything else you'd like to add?
Yeah, just quickly to say that Earth Ranger to me presents a huge opportunity, because if you're looking at integration and data sharing, there's so much that can actually be shared across. So I think that presents a huge opportunity. There's a lot of information that can be shared even from other different sectors. You know, if you're looking at even the animal health or the human health, that data can easily be shared. So having that platform presents actually that opportunity. So that is what I can say, like those 30 seconds.
Wonderful. Thank you, Stephen. Well, with that, I will turn it back over to you, Mark, to give us some closing remarks.
Great. Thank you very much. And for our audience, the recording of this webinar will be on our YouTube channel. And if you've registered for it, you'll get a notification of when that posting goes up. So to wrap it up, you know, at any pandemics, we believe no community is too hard to reach, that no country is too poor to innovate, and that ingenuity outshines fear wherever we've had the privilege to foster and support innovations in disease surveillance. So today you heard from pioneers working at the first mile, that being those places where the driving forces of disease emergence are swirling and blending and bringing forward new and emerging infections. Participatory surveillance is economical, scalable, inclusive, and can reach across livestock, wildlife, human, and environmental health to eventually predict and prevent the next emerging threat. So with that, we thank all of the panelists and we thank you, the virtual audience, for joining us today. Be well and goodbye.